ask something. Right. So this afternoon, we are going to interview Dr. Simon Gillson, who is Medical Director of Concierge Medical, one of Grapevine's partners. It's a private doctor's practice in Gloucestershire and, well, surrounding counties.
Yeah, we Worcestershire, Warwickshire, Oxfordshire. I think we just say Cotswolds, and our boundaries are notoriously vague, Amanda.
Okay, brilliant. Anyway, they are fantastic, and I thought I would ask Simon today to talk a bit about the dreaded COVID, and also having had a look at our results of the survey we did with Grapevine members. So Simon, just over 60% of the survey respondents, they don't think they've had COVID. The rest have either tested positive or think they've had it. Does that fit with what you've seen over the last few months?
Yeah, I'd suspect that actually probably even more people haven't had it, Panda. There are various studies that look at how many people in the community have got antibodies that have definitely had it, and we're not approaching sort of 40% having had it. We're much lower than that, which is, of relevance when we're talking about herd immunity and things. So I would say yes. There are lots of people who haven't had it. We had a sort of a spurt of people with it in sort of late March, early April with the original lockdown, and then things were really quiet because I think the original lockdown worked, but we did see we did do some positive tests, sort of probably 3, 4, 5 weeks ago, just before we went into the second lockdown, which sort of fitted in with what we were seeing in the more general numbers, that cases were going up in the Cotswolds and surrounding areas. But I haven't seen a positive one for the last, certainly over 3 weeks now.
Oh,
maybe
well,
4.
Good.
Yeah.
That's encouraging then.
It is. Yeah, it is.
Yeah. Simon, there's sort of a lot of, well, or maybe not enough talk about this long COVID thing. Now, it sort of looks like over 15% of the survey, obviously they believe they've had it, but they've had they've had symptoms that have lasted for, more than 3 months, and some are still suffering. Does this reflect in what you're seeing?
Yeah, I mean, I think there's a few things to say about the illness. That whilst a lot of people are getting fairly minor illnesses or even asymptomatic illnesses, people, when they're having a full-blown acute COVID infection, it's a miserable illness. And whilst we rightly look at the cough, the fever, the anosmia, the loss of your sense of taste or smell as the sort of key features, the profound lethargy in the acute illness and the headaches, I think, are the things which people are reporting, and they are not necessarily going away particularly quickly. And that's this concept now that we've seen of long COVID, which is, persistent symptoms. This is, for those people that are still or this is just another variant of the flu type thing. Yes, we see people with flu. Yes, you can have a sort of a post-viral fatigue syndrome. But I haven't seen it like this ever in my 25 years of being a doctor. This is a different sort of illness. And yes, we're seeing people with symptoms, not just 3 months later, but 6 months later. They were in the original, bunch of people that got COVID in that sort of early days, the March sort of upswing in the numbers, and they are still struggling. And the difficulty is that we don't know enough about this illness yet. And so lots of these people are going through lots and lots of tests with lots and lots of different specialities, respiratory physicians, cardiologists. Yeah. And some of them are showing abnormalities. So you do get a myocarditis in some people, which is inflammation of the heart muscle. Yeah. We are seeing people with blood clots on the lungs. That seems to be relatively common. But there are also a lot of people where there isn't really anything at all found on these tests. You're just not right.
I go with that.
yeah. I mean, it's not much fun. And I think, as you know, Panda, it's you can have some good days. And what's bizarre about it is the relapsing and remitting nature of it. You can have some good days, and then you can be absolutely poleaxed again by it with no obvious trigger, such that you're having to return to bed, 2 months after the illness, and there's no rhyme or reason to it. So I think we will definitely see over the coming months more research into long COVID. Are there any predictors? But it doesn't seem to be, it doesn't necessarily seem to be related to the severity of the illness. It can happen to anybody. Whilst one might expect that people who've been ventilated or close to being ventilated because they've got significant respiratory issues might suffer with significant ongoing issues. It doesn't seem to be just that. It can be people with fairly mild illness, and that's going to be a challenge going forwards. Is how can we quantify this? Can we predict it? Does it matter anymore? Because if the vaccine works, is it really an important consideration? But it's certainly a real important consideration for those people that are struggling with it, because it is profoundly challenging for them.
Yes. Yeah. No. Awful. So there's been a lot of, as you know, criticism about the circuit breakers and the tier systems and all that. And the survey we did had sort of very mixed opinions. Over 50% felt that we need to get on with things to protect the economy, and the other 50% feel we need to have the lockdown measures to protect lives. What's your view on all the measures, economy over?
Yeah, I mean, there are lots of different factors that are pushing it. I mean, I think what we have to say on it to everybody is that lockdown is hard. It's hard on people, for lots of different reasons, financial, that work pressure. It's hard, and it's hard mentally. And I consider myself quite lucky. I'm mentally pretty robust. But this second lockdown, perhaps more so than the first, is hard work. And I don't think anybody should underestimate that. No. And they should seek some help, if they're struggling, because it's not just them. We're seeing lots of people with it for sort of multifactorial reasons. I think the second lockdown, I'll come on to the first lockdown, was absolutely the right thing to do. I'm reticent to use the word unprecedented, because I don't think a disease that we are watching happening elsewhere in the world is truly unprecedented. We can see what's happening, and we didn't respond particularly well. But the point of lockdown initially was probably twofold. The one is that you have to protect the NHS, because the NHS would have been overwhelmed with the numbers of cases had we continued without any sort of attempts to suppress the virus, which is what we were doing for quite a long time. So, the NHS needed protection, but actually lockdown isn't a long-term solution. Lockdown, what it's supposed to do is provide you with time to develop an infrastructure. Really, and what we're saying here is test, track and trace, so that you can, when you try and return to normality, you can then instigate that program and actually
you're equipped, I suppose.
You're equipped. And that's probably one of the biggest failures, I think, from my point, is that we never really got to that point. So instead of being able to find people that were symptomatic, test them, get the results back quickly and say, you have to isolate, we need to test your family, or you haven't got it so you can carry on working. Instead of doing that, we ended up shutting down towns and cities, and then people saw an inequality there and didn't perhaps abide by the rules. And then we got, then we had those rising case numbers. And again, we ended up with the NHS being under pressure. So I absolutely get the people that say we need to protect the economy. We do, because the ill health which you get with a failing economy and poverty is also a massive, massive issue. And may well outweigh the number of deaths that we're seeing from this acute infection. But also, that's no good to anybody if there's no hospital bed for anybody, because every hospital bed is taken up by a coronavirus patient. And we weren't at that stage, but that's because we massively increased the capacity for beds. So this is the second lockdown is trickier because it's more complicated with the different tier systems, and because I think people are probably seeing that actually, had we dealt with it in a different way, we might not have got to this stage. We might, it is hard to say. I don't want to be overly critical, but we didn't have a test, track and trace, and that has held us back hugely.
What do you think about Christmas And this sort of, I think it's 5 days, isn't it? We've got
Yeah,
5 days
it's,
reprieve. I mean, do
yeah.
you think that's going to drive us into a third wave?
Well, no, I mean, I am by definition, the Ebenezer Scrooge in the medical world. I mean, I dislike Christmas anyway, Panda, and I work every Christmas, always have done for 25 years. So I can live without Christmas. It makes no sense for anybody's public health plan to involve any public holiday. It just doesn't make any sense. And I see that you want to see your family, but I just there is no. I just don't really understand it. I just, it's if you look at the measures that we're about to move into in early December, when we go back to the tier systems, really the tier system has changed to really just be locked down with a different name.
Yeah.
If you look at the tier one regions, they really are Cornwall, the Isles of Scilly, the Isle of Man, maybe. And everywhere else is pretty much in lockdown, but with a different name. So for us to be able to say you can escape from that for 5 days, it just seems is a bit random. It probably is not the biggest issue. Again, it's trying to sort out the magnitude of how badly a certain intervention or lack of it will affect things. Will that 5 days make all the difference? No, but it won't help.
No.
There's no way it can help.
I think it's going to go a bit mad as well.
Well, I think that's the issue. Those times where people have said your status in terms of your restrictions is going to change in 2 days' time. You see a change in behaviour in those 2 days up until that point, and I think people will feel that they've got free rein to do things which they shouldn't be doing in that 5 day period. And I get you want to see your family. I absolutely understand that social isolation and the mental issues of being separated. But equally, say if the vaccine is helpful, then we're talking about this again in the short term.
Yeah.
And as I say, I don't personally understand it, and I won't be changing my behaviour over Christmas because I've got those 5 days.
Yeah. Yes, I mean, this is sort of similar thing. One comment from one of the members was they think those who are at risk know who they are. They should let them deal with it, and the rest go back to work and help to improve the financial situation. I mean, we've sort of covered that.
I understand that sort of thought process. I don't necessarily agree with it, because you cannot separate the kids at school and the people at work unless you are saying to everybody who's over 60 or over vulnerable, you really have to just stay in, which again is not practical in many senses. So I do understand that point. I don't think it works quite as smoothly as that your respondent suggests there. And again, you still risk the NHS being overwhelmed, and if the NHS is overwhelmed, then we don't get to treat the other stuff that is still happening. And again, that's nothing else has stopped because of COVID. We're still seeing all the other things that we used to do, but people are or certainly have been more reticent to talk to us about it because they didn't want to go to hospital, or they thought that medical services have changed. They haven't. We've carried on as normal. The NHS has changed a bit, but they are still there. But it's say the key with going about things as normal is your capacity to deal with the rising case numbers should they happen, which they will in some areas and maybe across the entire country.
And have you, going back to the the sort of other illnesses and people who perhaps have got something wrong and they don't want to bother you about it, or any further because of the COVID thing. Have you seen a lot of that with some serious consequences?
I wouldn't say that we've seen it with serious consequences, because as I say, we are lucky in that we've got small numbers of patients per doctor, so we're able to be on top of that. But I do think, quite understandably, certainly in that first few weeks of lockdown number one, people were reticent to have us visit. They were reticent to tell us about any new problems because they didn't want me to say, right, you do need to go to hospital. But we've had to try and change behaviour. Actually, it's all about trying to assess risks, and is the risk of ignoring this potentially damaging symptom for a few weeks, more than the risk of potentially exposing yourself to coronavirus rather than just staying locked up in your house. And so it's tricky, but I think we're getting to the point where, you can't continue ignoring potential cancer diagnoses because they are time critical and treatment is time critical. And so, there's definitely a sort of a change in our behaviour at Panda where people are telling us about things and we say, right, we can give that another 2 or 3 weeks and then we'll reassess it.
Yes.
But equally, there are still certain things where people are needed to be seen ASAP, and we have to just push on with that, whatever's happening, because the COVID thing is irrelevant in terms of relative risk to that person.
Yeah.
And that's a difficult message to get across, but that's our role. We've got to do that because there's no point hiding away from coronavirus and that, not getting exposed to that whilst something terrible is happening and we are failing to investigate it. That's where we're. It's tricky, and then everybody's got sort of a different frame of reference. But we just, as the medical profession, needs to be cognizant of the other stuff that's still happening.
Absolutely. And Simon, this herd immunity, do you think we're going to reach a herd immunity situation in the end, or do you think we're going to be in restrictions until that happens, or do you think vaccines going to
Well, I mean, herd immunity is a real thing. It is where a percentage of the population has been exposed to either the illness or has been vaccinated against that illness, and you don't have to have 100% to make it safe. What you're thinking is that, let's say you've got 80% of people cannot get an illness now because they've already had it or they've got vaccines. If you think about those crowd situations, and you are, we go back to the early days when we're talking about the R number, and with coronavirus, one infected person would typically give it to 3 others. Well, actually, if those 3 others standing around you or those exposures can't get it because they are already protected, then actually you're putting bigger gaps between people who can get it. Now, early on in the piece, definitely Sir Patrick Vallance, and the SAGE committee, were pretty far off the mark in thinking that they might get herd immunity by just allowing this to run through the country. But when there's a potential case fatality rate of 0.5%, 1%, that's a lot of people dying to get you to the point where you want to be. And then that was one of their light bulb moments, that when Imperial College released one of the studies that said, actually, you can't carry on just trying to mitigate this by washing your hands and things. You've got to try and suppress it. But they were really late to the party with that. Even on the 13th of March, Gold Cup Day, the SAGE committee meeting was still unanimously agreeing that we shouldn't try and suppress the virus.
Yes.
So we were late. They were trying to achieve herd immunity by natural spread of the disease. I'm not sure. I would have to look it up, Hannah, but I don't think we've ever achieved herd immunity without vaccines, because it's the consequences
on the way.
Yeah. And that's a very medieval thought, to just let it run through and so herd immunity, yes, but herd immunity with the vaccine is the key.
Yes.
And herd immunity doesn't mean that everybody has to be vaccinated. There are people that can't be vaccinated because they've got health problems, but we protect them by reaching that herd ourselves, and therefore they have got that protection from the virus, because the virus doesn't have anywhere or has very few places left to go.
Yeah. And do you think that this vaccine really is just around the corner?
Well, I mean, we're probably as much in the dark as anybody, really. I mean, because a lot of these announcements seem to be made for maximum media coverage, and they're not. In a normal world, the medical profession would know in advance of a new treatment coming out and things, but that's not happening at the moment. There's a bit of theatre where we're told about the vaccines, and so yes, I mean, I know that people are being given the warning that they might be expected to be administering this vaccine as early as next month. I think that's the Pfizer one, and the Pfizer one comes with some incredible challenges that I can't work out how we'll do it, because it's got to be stored at -80. So that's very different to the Oxford vaccine, which may not be the headline figures may not be quite as good in terms of protection, but actually if you can get 90% protection and you can just take it out of a normal fridge and give it, then that's much better than 95% protection from something that you can't actually get to the population because of the restrictions in Trump. So I think vaccines are on the way. How effective they are, those studies so far have been pretty small, but they're encouraging.
But do we know? Do you know whether this is a yearly vaccine, or is it? I mean,
we don't.
We're going to have like flu injections every year.
Yeah, we don't know the answer to that yet.
Okay.
If I had to, a suspicion, it would be that at the moment we're going to have to carry on living with coronavirus, and if it mutates like the influenza virus, that this might be, we might live alongside coronavirus with annual vaccination programs.
Yes.
But again, it's too early to say that. There obviously are medical conditions where you can achieve lifetime immunity from a single vaccination program. We're just too close. And this has been the interesting thing in medicine at the moment. Is this the first time? I've been qualified 25 years, so this is the first time we're learning about something as we go along. I've learned about everything else from the textbook. Now we are seeing it. Now we're seeing it, and it's there's a lot that we still don't know.
No.
But equally, what's interesting is that if these vaccines do protect 90% of people, then again that gets us, assuming the uptake is right, towards that herd, which allows you to return to normality without worrying about overwhelming the health service and all the knock-on effects that has on those other issues that we talked about. And
Simon, I'm sorry, you might not know this one actually, but I'll ask anyway.
There's things I don't know.
So if one has got antibodies, it's suggested you still have the vaccine. Is it?
I haven't read that, Panda, but I would assume that it is still suggested that you have the vaccine.
Yeah.
Because at the moment, there is no suggestion that having the antibodies, you continue to have the antibodies for any length of time. In fairness, there's not really a lot of suggestion that you don't have the antibodies for a lot of time. We're only just over a year since the first case ever. So we just don't know. And certainly I've, on a practical level, have done antibody tests from somebody that had COVID infection in March and have redone them recently, and those antibodies are detectable. We're not measuring levels, unfortunately, but they are still, those antibodies are still there and detectable. Yeah. So we don't know at what time frame they would wane, if at all. But I think the likelihood is that they will suggest that everybody has the vaccine, whether you've had it or not. Like nobody's, whether you've had it or not doesn't make any difference about your isolation, or if you're exposed to someone that, again, at the moment, like Mr. Johnson, he's had it. We know he's had it. He had to go into isolation because he came into contact with someone else. He had a test, which was a pointless test, because actually it didn't make any difference to what he did. He had a negative test, and then people said, well, why don't you go back to work? When actually the rules are, doesn't make a difference. You've still got to be isolated for 14 days. So there's still a lot of confusion, even at that level. Yeah. I think people that have had it will still be encouraged to have the vaccine. Whether they will or not is a different matter, but I think they'll be encouraged to.
And Simon, I mean, a few people I've spoken to are quite sort of fairly sure that they will not or do not want to have the vaccine. Because they're concerned that it's been rushed through, and what might the repercussions be in X number of years. Because wasn't there was it swine flu?
Yeah, I mean,
wasn't there a vaccine that came through, and then it was sort of, I don't know, they found out that it caused...
there's a slightly elevated, but I don't think it's a statistically significant incidence of narcolepsy in people that had the swine flu vaccine.
Narcolepsy, that's not too bad, is it? Well, no, I suppose if you're driving it in.
I mean, it's not the the worst condition, you know, and it's like, again, it's that balancing the risks and things. And I get the point that people think we've rushed the vaccine through, and again, we are seeing this vaccine developed at a time frame that I've never seen. But what was interesting is I read an article about from a fairly a significant researcher into vaccines and things, who pointed out that actually one of the differences at the moment is that a lot of their time when they're developing a vaccine, which it might be over a 3 to 4 year period, is spent going through the red tape phases about applying for grants, putting together a methodology, all that sort of thing. And all that red tape has been blown out of the water by the governments around the world desires to just crack on and let's see if we can find a vaccine. So like anything, you know, you can never say what effect might something have in 5 years' time until you've got to 5 years' time and said, you know, we can look back now and say, well, actually, you know, 20% of people got sensorineural death from having the vaccine, but they're still alive. You know, we don't, you know, I'm not suggesting that there's any issues with this, but we just don't know. No. Having said that, I think, you know, the illness itself and the, you know, the significant problems that people are having with long COVID, to me, is a much bigger risk than having a vaccine. They have been properly trialed. You know, we're not cutting corners in that respect, but we will not be able to study what will be happening 2 years down the line. No. Because there isn't you know, if we're talking about wanting to get the economy back to normal and returning to any level of normality, we've got to aim to get that herd, and the only way to do that is to vaccinate. So I understand people not wanting vaccines. There are lots of people that don't want vaccines, full stop, and I will never. I do get it with this one because this is different. I don't get it on a general. Never have. You know, it's one of the odd things that we've managed to invent technology to eradicate disease and then ignore it because we've forgotten how bad it was. You know, I'll never quite get that, but I do understand people's, you know, sort of wariness here. But I don't think would I have it? Yes, I think I would. I don't, you know, it's, you know, we'll look at the data when there's a bit more available. There's not a huge amount now, but it would be, you know, it would be, you know, the government and the scientists, given their role in this, will be fairly careful about rolling out something if there's any potential damage.
Well, thank you, Simon. One last thing. What do you reckon? I don't know. Let's say March, Cheltenham Festival, outdoor events. Do you think we've got any hope of there being maybe if vaccines have been rolled out partially, if having, you know, not having it behind closed doors?
Yeah, we certainly, there is no chance of it happening as it did this year. I mean, we're not going to be back to that level of normality by March. And again, we you know, you have to look at the difference between the transmission risks. I mean, you know, transmission outside the risk is virtually negligible. It's the indoor activities, and it's the bars and the toilets and the other things that are worrying. No, I don't see that it's likely that we'll have, you know, reduced crowds. Yes, I mean, they're talking about having some. Personally, I think it's odd that we've got such tight restrictions starting on, where are we now? On Wednesday, on the 2nd. Yet from that day, you can have 2,000 people on a race course or at a football.
Doesn't make sense.
That doesn't make sense to me yet either. Even though, you know, I would have said, you know, it certainly doesn't make sense if you couldn't do it in August where it's warm weather, everybody's outside, and the rates of infection at that time were significantly lower than they are now. But I think it's the vaccine gives us a hope of returning to normality, but I don't know that we can put a time on that, because I think it depends how quickly they can, you know, they've ordered, you know, various different kinds of vaccines. I think enough for everyone to have two, and we need to have two. It's a two. You know, but how quickly can you logistically get 60 odd million people vaccinated, or, you know, that's going to be the issue. But you know, I think the vaccine will help us at least do things stepwise. And say I'm not always being convinced that they've taken the right stepwise things, like say just going from 0 to 2,000 people at a venue for football round or whatever. But we'll see. And the vaccine will certainly help with that.
Yeah, yeah. Oh, Simon, thank you so much. That's really interesting to hear your views on everything. And hopefully, I think the members will have found that interesting and helpful too.
Good. Good. Yeah.
Thank you very, very much indeed.
Perfect. Thanks, Amanda.
And we will, be in touch soon.
Perfect.
Thanks, Simon.
See you soon.
Bye.